Health workforce shortages and winter burnout have hit cancer surgery, with operations being postponed across the country.
A general surgeon who specialises in bowel surgery told Newshub it's got worse in the past 2 months. Investigations correspondent Michael Mora has the story.
General surgeon Frank Frizzell should be in theatre operating, but he's holed up at home with COVID-19. But he's clear it's not just COVID causing staff shortages, it's long-standing vacancies and burnout.
I've never seen a time like at present. It's the worst it's ever been.
He says not only is planned care like hip or knee replacements being pushed back, cancer surgery is too. And it's got worse in recent months.
Once you've cancelled those that aren't cancer, you've got no choice but to cancel those with cancer.
This graph shows what's happening at Christchurch Hospital, where Frizzell works. The orange block indicates elective or planned surgery postponements rising sharply since April this year and hitting 1,200. And the blue block is delayed cancer surgery, more than 400 operations since March 2020. The government's Cancer Control Authority confirmed to Newshub some cancer patients have experienced minor postponements to their surgery or treatment given the current pressure on the health system. But Frizzell says there's nothing minor about any sort of delay, saying some cancer surgery is being delayed repeatedly.
There's delays all the way along, so it's like a series of dams that stops people moving through the system. At every step there are delays. The Minister's comments that the failure to see a crisis really outlines the fact that it must be looking in a different direction.
In February this year, research found around 60% of breast cancer patients were not getting surgery within 31 days of diagnosis. And the Breast Cancer Foundation says that number has only got worse in recent months. And that has significant impacts.
It's the most stressful time in that patient's life already, and any delays just further increase that anxiety.
Because it could result in death, ultimately.
Absolutely. Any delays can actually have life-changing consequences, whether it be cancer that it's harder to treat or potentially even life-threatening.
She says there aren't enough frontline staff.
We've heard of surgeries being cancelled. We know that there's a massive constraint on anaesthesiologists, nurses.
I think we need some better leadership in health management. The senior management team in health need to look at what they're trying to deliver and get on with it properly.
And he says that starts with getting more staff and improving infrastructure, such as more operating theatres.
Well, Michael, thanks for joining us. You've just got off the phone with the Health Minister. What did he have to say?
Yeah, the Minister, Andrew Little, says he's aware of some delays with cancer surgery and that it's his expectation that such delays will be brief and that they won't impact the outcome for patients. On the staff in crisis, he told me that the government has added 5,500 extra staff and that Health New Zealand is about to embark on what he called a high-impact recruitment campaign for more staff. But Frank Frizzell, the surgeon you saw in my story just then, is very clear that this situation was entirely predictable. At Frank's hospital in Christchurch, on any given day, there's 150 nurses short, and he says that it feels like the government, successive governments, have neglected the health system and its workforce for many years.
Michael, tēnā koe.